So cancer should be diagnosed by screening in early stage by that way. There should not be any symptoms. So that when you do, then we found out. That's why I always say, as a slogan, you may have cancer, I may have cancer, anybody can cancer, even without symptoms. That means majority of the cancer early stage, no symptoms. So the screening very easily can detect it. And with certain risk factor, which I mentioned, can be treated. So cancer preventable.
Hello and welcome to the 32nd IMA International Management Conclave 2025. Today we have with us world-renowned gastroenterologist, cancer surgeon, a philanthropist, Dr. C. Palani Vellu. I hope so I have got it correct. Chairman, GEM Group of Hospitals, Coimbatore. Welcome, sir. We are honored to have you with us today.
Very nice. I'm allowed to be part of it.
Thank you, sir. Sir, your achievements, your accolades speak tons. However, you continue to work tirelessly in the medical field, giving back to the society. So, what keeps you motivated every day?
The problems among the people, their gastrointestinal problems are plenty of this, and they are suffering it. And we have not found out end point. So we start working out, making a new science, helping them. But still disease number increasing on, and the people are suffering more. Naturally, we have to work hard endlessly, that creating it. And many of the diseases in the past, there was no treatment, proper treatment. Nowadays, we have a technology and we have a system identified, and the proper treatment, we are able to bring it, but still not reach the complete people. Section of people are getting it, still common people need to do. So a lot of things we are doing from gastroenterology and cancer point of view. And over this, for decades, we are doing it.
Okay. So when we listen to the word cancer, we all are afraid as to what is in store for us, our family, and our friends. So can you throw some light on cancer, the stigma around it?
Yeah. If you say today, any one person that you have identified a cancer, 50% mentally goes down. The reason, the society has got a myth, cancer means incurable. Hereafter, they can't lead a normal life. Socially, they cannot mingle. And they have to undergo chemoradiation. So they become bald-headed, thin-built, ugly-looking, and shortly they're going to die. That myth they have. And that is a problem today. It is not that. And the cancer also is like any other disease. If we identify in early stage, and cancer can be completely treated well, cure can be achieved, that the people should know about it. But the problem, cancer identified at late stage 1. There are some cancer comes in a family system. One fellow develop cancer, whether it is familial or it is otherwise, most of the family member thinking, we are going to get cancer, we are going to say. The fear among the people much more. It is smaller percentage people agree genetically or family-wise will come. Majority of most of the cancers are either diet or infectious or environmental or that is kind of reasons it is coming. So nothing to worry, but everyone has to undergo screening to identify early stage. Today, we have a technology to treat cancers very well, and the cure can be achieved.
So any lifestyle changes that you recommend to us so that diseases like this could be avoided? Any lifestyle changes, like, the basic problems that we have, our eating habits, our stress levels, our sleep cycles. So do these play a major role, a pivotal role?
Yeah, very, very pertinent question. Yes, lifestyle more important. And those days, cancer was affecting older people.
Yes, sir.
More than 40 only later we see, we don't look at young age. Now, young age also getting it. Yeah. The reason it is a lifestyle, also environmental and diet. For example, our people eat carbohydrate diet, they put on weight. Obesity people, the incidence of fatty liver, cirrhosis, cancer or general cancer, and also induces GERD inducing esophageal cancer. And so that kind of thing, when you take it at a improper diet, constipation or indigestion, then colon cancer. So like it is one thing. The second is also food adulterated. Most of that we use plenty of insecticides, and that also induces some kind of this also. So second thing, we should have a more quantity of, every day we should eat more of fruits, vegetables, and there are so good, but our people don't look at that. They like a taste. They like, that kind of way they're going. Most of Indian people, they're now become obese. Belly is more common. Fat inducing problem much more in induced lifestyle. There is a reason people have to know. Cancer is increasing because of our immune system and goes down. Particularly after COVID infection, and now we see a lot of higher percentage of cancers in all the groups.
Yes. So, sir, I would say there are some avoidable and some unavoidable changes in our lifestyle that we could do to avoid it. We see heart attacks in youngsters, 2025. Like some years back, this was hardly seen or heard of.
It is cancer is two things we are common people has to know. One is preventable. Second is curable. Preventable in the sense I will say, for example, H. pylori in the stomach induces stomach cancer. By endoscopy, they can find out very easily. H. pylori, treat with a medicine. There are available medicine with a 2 weeks treatment. Most of them get pylori disappears. Similarly, in liver, if we take it, hepatitis B and hepatitis C induces changes in the liver, cirrhosis, and subsequently hepatoma. Liver cancer is very high. So that is also preventable. No, there is a vaccine available for if you have this type of B vaccine can be easily prevented. Second, also we can prevent it in the reflux. GERD people are those days ulcer common, now reflux common. So acid when reflux into the esophagus frequently produces ulceration in the esophagus, that leads to adenocarcinoma, which I am seeing more and more today. So that is also preventable proper treatment for GERD. Taking alcohol, smoking, fatty food, reflux coming more. So it in our hand only. Same way, colon, rectum, we take it, the polyps, small polyps only induces cancer later on. So regular screening, colon, polypectomy easily can be removed outpatient basis. So you can prevent cancer. There is a way to do it, no? So most of the cancer, we know the reason why. Maybe some of the cancer like pancreatic, some people may not know. Ovarian cancer may not know. Even uterus we can easily identify. So most of the cancers, we have way to prevent one aspect. Diet changes or by the risk factors treating it. Second is also regular screening. One should not wait for the symptoms. Pain or loss of appetite, weight loss, then unable to work. That is stage if you come to hospital, if you diagnose cancer, more than majority of them have advanced stage. So cancer should be diagnosed by screening in early stage by that way. There should not be any symptoms. So that when you do, then we found out. That's why I always say, as a slogan, you may have cancer, I may have cancer, anybody can cancer, even without symptoms. That means majority of the cancer early stage, no symptoms. So the screening very easily can detect it. And with certain risk factor, which I mentioned, can be treated. So cancer preventable. Second is also regular screening able to identify early cancer. Early cancer stage 1, 2, most of them are completely curable. And those days, of course, open surgery when you do, we have to give more blood and we have to open, the immune goes down and the recurrence very high, cure it also. Now we have a fantastic technology, laparoscopic robotic magnification of the tissues, clarity identification. Not only they're specifically scanning the cancer cells by fluorescence. So ICG is now available, you give it, that takes up only by cancer cells. During surgery, we can see it is glow. So everywhere it's but you can identify, take it out.
Yeah.
So very important. Even some cells may not be able to remove, but we have target therapy.
Yes.
ICG tag target also control it. So and laparoscopy, robotic, if you do, not only we are cure more, we don't open it. If we don't open, immune is not disturbed. So that recurrence is also prevented. So today, avoiding blood transfusion, avoiding opening, one immune is protected. So future recurrence is also minimized. So now cancer, surgically treatable cancer, that has to message reach every one of the common man. The fear will go.
Yes, very optimistic, sir. Very optimistic. Now, I'll quickly take you to the rapid fire round, sir. So, one word to describe your journey in medicine. One word.
What?
One word for your journey in medicine.
A journey, I am a farmer. So I realized there are certain problems facing the people. So helping the poor, a minimally invasive surgery, I introduced first time in South India, promoted across India. And from start with the gallbladder, entire gastrointestinal system. And today, minimal invasive is the way to treat, and people get back routine work faster. That is my happiness.
Okay. So any mentor? Any mentor?
But for me,
Yes.
no, for me, of course, professor of surgery made me to go into MS medicine. When surgical gastroenterology, MCH came, Professor Rangabashi made me to go to gastroenterology. But minimal invasive surgery, for me, I'm the mentor, and the people taught me what we need and identified the problems like a hernia, cancer among the farmers, agriculture group. If I do minimal invasive, I can get back to work. So it is complete development my own. There is a reason I induced Coimbatore first time, even before Delhi, Bangalore, Calcutta. So that made it. Now I'm a specialist in GI surgery, so I could make it into minimal invasive. Today, world looks at something like a different way.
So one book you recommend?
This is, I think, and those days we all used to go to America, United Kingdom to learn, and we used to read their book. I don't know, Susruta was the first surgeon world over known, and his book has been, everybody read those 2000 years before. Now, again, we're looking at West, but minimal invasive, India is a leading country, and we innovated many procedures before, and the first time in the world before another country. So the innovative technique has to go in. So more than article publication 500, I wrote books, and this book has become the international standard textbook. It published in Chinese, Korean, Latin, Spanish, all languages. So the book, which if you ask me to read, more than it is personal experience, I'm putting in a book. All other Indian surgeons all over the world, they follow my book. So this is where
So your dream for the future of Indian healthcare?
yeah. India is a very highly potential. This only the lack of awareness or confidence among the people is the most important things. And today we have to create among the people confidence, awareness about the disease, and we have the potential. All youngsters should learn, and the modern medical care, both medicine and surgical side, and world looking at India surprisingly. The cost of treatment in India is much, much lower than any country. And then not only that, Indian people have got empathy towards the people, the timing or this, they're working such a way. I think India should come up. Now, right now, the world looks at India for many innovative techniques that come from India, and they follow as my own technique, like Palani Vellu's technique for esophageal cancer, pancreatic cancer, and many 25 innovations I've done. So instead of we alone, youngsters, they got a lot of opportunity. That time, for no one was guiding us. Now we are there to guide, and the society is there. We are offering fellowship. We are encouraging them. Nook and Corner India conducting course. Future India will become medical tourism, other aspect which I'm not interested talking about more. I'm more interested in giving a high technology technique to our people. Also, India should become a medical training hub. Western people should come to learn and go. More than that, coming in treatment is spoiling awareness. Our skill should go to our people. That way, our society is working mass to the masses. Minimal access surgery to the public common people. For that, I'm making a cost-effective methods. So almost all socioeconomic strata people are affordable to it. Second thing, people also must accessible. Everybody cannot go to cities. That's why what I made it. I'm making it training the surgeons more particularly in rural area. And so when they go and practice everywhere, people have got access easily to get in. So it is affordable, accessible, and that is every world over, they're looking at India something surprisingly, how these people are able to do with the so effective way, cost effective way. And that I'm happy about it through my own society. I must say I'm helping the Indian surgeon come up. That's why everybody has got a great love and affection. Today, this management I'm talking, I'm so happy.
Thank you so much, sir. Thank you. It was wonderful having you with us, and you've given us a huge ray of hope, sir. Thank you so much.
Yes, I'm very thankful to IMA, Indore for inviting me to share my experience in this. And I'm very happy. I thank the office bearers and this. I wish good luck to every one of us. Wish for India to have as business managing groups, people I started a single specialty super specialty hospital in India, gastroenterology, now minimal surgery. And by more learning, youngsters can do much more than that. So management group people have got I think, I hope today's my talk would help them. Thank you very much for inviting.
Thank you, sir. Thank you.